Well, it is time now to talk about the other V today, the vagina. And let's just be real. Things change down there when we get into our 50s and enter menopause. Vaginal dryness, painful sex, and incontinence are common problems. The MonaLisa laser treatment was first offered globally in 2012 and is now for the first time available here in Augusta. Watch this.
The MonaLisa is a safe, painless treatment that helps women who are suffering from VVA, vulvovaginal atrophy, a very prevalent problem in America today. The laser supplies light energy to the vaginal walls. They stimulate a healing response, which creates new collagen, new blood vessels, moisture, and elasticity to the tissue.
When you first hear about it, you think, oh, can this really work? It sounds kind of far-fetched. Then when I realized that it really would change the structure of the cells and that it wouldn't be painful, that made sense. It's really quick, and afterwards there's no difficulty, no discomfort, and no side effects.
The results are promising, they're excellent, and they're reproducible. And it gives me the confidence to be able to say, I really think you should give this a try because you deserve to feel better.
Dr. Ron Eaker and Dr. Alan Joseph of Women's Health of Augusta are the first in the CSRA to offer this new laser technology, and we are so pleased to have with us today Dr. Eaker to tell us more about it. Thank you for your time.
Thanks so much, Jenny.
You know, you were telling me that this is really a very cool thing, and people just need to know it's available.
That's the biggest problem we have right now is just knowledge, just people understanding they have choices and options. You know, when you think about this problem, a lot of it is almost like it's a silent epidemic because people don't want to talk about it. Either they don't think anything can be done about the problem, or they feel like it's just normal aging. So oftentimes, even with their gynecologist, they don't bring it up, they don't discuss it. Well, obviously, if it doesn't come up, there's not much we can offer as far as solutions. Yeah. So we like to try to make folks aware that there is this new non-hormonal mechanical treatment that really makes a massive difference in this problem.
What I was reading about it too is that it's so quick and you go right on with your day.
Exactly.
There's no downtime.
It literally is a 5-minute in-office procedure. It doesn't require any anesthesia. You know, people hear the word laser and vagina together and that's a little apprehensive for some folks.
Sure.
But the reality is it's pain-free. It takes 5 minutes, and I've literally had people go out to the gym afterwards. You do a series of 3 treatments by 6 weeks apart, and that constitutes what we call our treatment profile. Some people actually see improvement after the first treatment, but we have studies now that indicate that up to 88% of folks are extremely satisfied with the results they get. And it's all about the symptoms. It's all about treating the results. People are able to be intimate again. I had a lady in the office not long ago who said it had been 2 years since she and her husband had been intimate. Just imagine what that does to a relationship. And after the MonaLisa treatment, well, I'll say this, her husband called me and said how appreciative he was for the results. So it's a very effective tool for folks who may not either think they have any options or don't want to deal with the other options, which are largely either over-the-counter products, which don't really work that well, or hormones.
Now, when you're talking about incontinence, is this the kind of thing where, you know, like if you sneeze, you might leak? Is that what incontinence means?
Yes, and there are some studies, and they're actually looking at trying to get this now approved specifically for this condition. Right now, we're finding it's kind of anecdotal. We're seeing many women who are seeing incontinence improvement.
So it's like, oh, this is better too.
Exactly.
Now,
exactly.
Another thing that you were explaining to me is that it's specifically or especially good.
You said that much better than I did just a moment ago.
Oh, see, I was showing off. No, especially good for people with breast cancer?
Absolutely. That is probably the most satisfying place where we utilize this. Women who have had breast cancer oftentimes will be in menopause either through surgery or chemotherapy that destroys the ovaries. In fact, we're seeing a lot of younger women in their 20s and 30s who have survived breast cancer because the treatments are so great. But yet, because their body has been depleted of estrogen, by the time they get into their 40s and 50s, are having horrible issues with vaginal dryness and pain with intercourse. Well, of course, there are many women who are very apprehensive, along with their doctors, about then using estrogen to treat that problem. So up until really this laser came along, they didn't have any other options. But now that is a group that really is reaping the benefits of being able to treat that problem but not create any risk for any hormone use with the breast cancer.
That is very amazing.
Yeah,
that's
it's opened the doors, because
yeah.
up until this point they really didn't have very many solutions at all.
What about, does insurance cover this yet?
No, it is not covered by insurance, so it's an out-of-pocket expense. But like everything else, we want to put that in the context of the value that you're getting, the relationship enhancement, just taking care of the symptoms. Probably the biggest thing about this also is it's generally a one-and-done situation. 90% of people will have the treatment, the series of 3, and that's all they need. It's just, it's different from the creams, where people will have to continually use those literally for the rest of their life.
And may I say one thing and get on my soapbox, because you talked about, you know, the enjoyment of the relationship. Does insurance pay for Viagra for men?
They do, which is absurd.
I always think that's so interesting.
It is.
Don't you, women? Don't
Yeah.
you? It's.
Yeah, I know. I agree with you 100%. There's such inequity in that system, because essentially this treats a problem that is rooted in medical issues. There's no question this is a medical problem, and it's so incredibly widespread. My instinct is that at some point that might happen. Some progressive insurance companies will realize that the benefits that the patients are getting from this are well worth the value.
Yeah.
But I don't see that anytime soon.
Well, Dr. Eaker, you have given us so much good information, and people can contact you at your office.
They can call our office.
We've got that information on our website for you, so all you have to do is click on the JENNIE link on WJBF.com, and we'll redirect you right to Dr. Ron Eaker's practice, and you can learn more about this and weigh your options for having the MonaLisa treatment yourself. Thank you again for being here.
Thanks so much.
Next on JENNIE, it's a condition that often goes undiagnosed until a girl doesn't start her period. How researchers at the Medical College of Georgia are studying the causes of MRKH syndrome after the break.